we are demonstrating the use of a high-flow radial artery graft bypass and the management of a giant middle cerebral artery aneurysm involving the M1 segment of the middle cerebral artery. This was a 19-year-old young man who presented with a right hemiparesis. During the workup of the stroke, he was found to have a giant middle cerebral artery aneurysm involving the M1 segment with a very complex shape and involving the entire M1 segment. After considering and discussing all the treatment options, microsurgical treatment was recommended. A distal bypass graft was planned, followed by clip trapping of the aneurysm. Microsurgical technique was preferred over endovascular technique due to the durability of the operation, the surgeon's expertise, and the goal of preserving distal lenticulostriate perforators and achieving a permanent cure. The patient had exposure of the cervical carotid artery and suitable radial artery graft. The aneurysm was exposed by a transsylvian approach after a frontotemporal craniotomy and orbitotomy. A bypass graft was performed into the M2 segment of the middle cerebral artery, and this was followed by clip trapping of the aneurysm with the preservation of the distal lenticulostriate vessels. Postoperative angiogram confirmed a complete aneurysm occlusion with the preservation of the distal lenticulostriate arteries and patent graft. The patient's neurological outcome was excellent without any further deficits, and follow-up examination did not show any recurrence of the aneurysm. This case illustrates the utility of microsurgical bypass technique for the treatment of such complex aneurysms in the era of floor diverter stents. Please read our video report using the hyperlink below.